Okay, so when we're discussing antipsychotics, I want to first talk about your first generation, your typical antipsychotics. And I have them written down because, man, I forget them. There's a lot. That's your guys' job. I passed 10 clicks already. So you have your chlorpromazine, you have your promazine, you have your haloperidol or haldol. That one's really common. You have your perfenazine, and you have your lexapine, or I think it's lexapine or levipine. I can't read my writing. But my point is, those are considered your typical or your first generation antipsychotics. The cool thing about those medications is they're pretty effective in decreasing those positive symptoms that we're discussing that are found in the mesolimbic system or the mesolimbic pathway. The problem is they also decrease the dopamine levels in all the other pathways, which exacerbate your side effects of this medication. So when people are taking these antipsychotics, it'll cause significant issues with gynecomastia, your man boobs. It'll cause galactorrhea, or men ejecting breast milk. It'll affect your EPS, your extrapyramidal symptoms. You'll have pseudoparkinsonianism. You'll have a wide variety, a wide range of dystonia, of an inability, inner restless or akathisia. All these terms, by the way, you motherfuckers got to know. Okay, you got to look them up. You got to figure them out. You got to memorize them, do flashcards, do something. But that's why these medications provide such profound adverse effects, because it also affects the other pathways that we don't necessarily want to regulate. The main one is that D2 receptor in the mesolimbic system or pathway. And that's why your first generation medications have those profound adverse effects, including tardive dyskinesia, which is a permanent, potentially permanent lip smacking abnormal movement that the patient develops, and it usually doesn't affect their cognition, but that's why that's a big problem. We have to be very careful when we're giving these medications to these patients. Some side effects, yeah, I mentioned already: dystonia, akathisia, Parkinsonianism, tardive dyskinesia, and things like that. So those are your typical antipsychotics, okay? But then we had those were made like in the 1950s. But in the 1990s, we came up with another type of antipsychotic known as second generation or atypical, and I'll be discussing those next.